Alimbara. Hello, everyone. We'll get started here very shortly. I'm just waiting for Dr. Ismail to hop in real quick and, we'll crack on. Let guy just do epic on your mind. Thank you. I like soccer jerseys a lot. I'm big with football. You know that already. So thank you for sticking by, man. Just give us like a couple of minutes and we'll definitely start.
There you go. Let's see. Can you hear me? All right, I can't hear you. One
Sorry,
second.
I'm muted. I was muted. Sorry about that.
There you go. How you doing, man?
I'm good, brother. How are you doing?
Good. You know, living the dream, as I say.
Good to have you on. Really good to have you.
Likewise, man. Love what you're doing, man. You've been setting a new pace, man. I love it.
Thank you. We get inspired by you and your likes and what you do, and So I've been obviously I've mentioned it to you. I've always wanted to really sit down and chat with you, and really, just to shed light on the very important work you're doing back home and around the African continent. And I'm big on that. You're big on that, and so I'm really excited to chat with you today.
Looking forward to it, honestly, man. I think it's overdue. We're well overdue.
Yes.
God's time is always the best time.
True. But really, let's get to it, man, because I know you're very busy. You have a lot of things to do, and so I'll try to keep this within the hour mark, and so that we can get it done with, and then continue with the rest of our weekend. But first off, to everybody following us from wherever you are, my name is Ibrahim Sonko. I am the host of the Dialectic Space podcast, and today with me is my brother, Dr. Ismail Badjie, who is a pharmacist and also an entrepreneur. Doc his camera is, I guess he's having issues with his internet. Ismail, can you hear me? Doc, are you with us? Excuse me. Well, we seem to be experiencing some difficulties with getting A's. If you're struggling, you can leave and hop back on. Really, it will still work. Okay, well, that makes sense. So Dr. Ismail will be back, but once he's back, we'll just crack on with it and we'll begin the conversation. Okay.
I'm back.
Yeah.
There you go.
Yeah. Are you in Gambia?
I am, man. You could tell by the internet, right? I'm on the struggle bus. That's why I just switched over to like a different internet just to be on the safe side.
Yeah, your boy Soldier always say you need to stop talking to people in Gambia. I said I can't help it. He said their internet sucks. I said,
man, they just need to approve Starlink so that they could save our world.
For real. But anyway, to crack on with it, like I was saying, my guest today is Dr. Ismail Badjie, pharmacist and entrepreneur in the Gambia, especially the important work he's doing with tech health, and also like really filling an important gap in our health sector not only in the Gambia but also around the African continent. And so I'm excited to talk to him today to explore his life and journey, and also to explore his entrepreneurship journey. His writing as well, as you know, Doctor is also wrote a book. I think a couple of years ago, probably like a year or two ago. I remember this vividly. I haven't had a chance to read it, but I would definitely love to. And when you came to Seattle, we could not see each other. I really wanted to. And I know your younger brother is here. And I've also been fortunate to meet your dad. I've also been fortunate to meet Fatim and Aisha.
Oh, wow.
Yeah, Aisha and I are pretty cool as well. So, I've known them way before you. And so obviously you've always been prominent too. But when I found out, I'm like, oh, damn, okay, that makes sense. Ismail and Fatima. And I went to you guys' house too a couple of years.
No way.
I did. I met your dad, man. It was wonderful, wonderful family.
I tell people, anybody who knows my dad, everything about me makes sense. If you just meet my dad,
no, yeah, well, absolutely. But yeah, so we'll just start with, the foundational matters, obviously. So we'll begin with, who you are, who is Dr. Ismail, really, where are you from in Gambia, and how long you've lived in Gambia, really what influences you growing up, what were some of those important values that your dad, who is, by the way, a very prominent diplomat in the Gambia, is a very well-known, has been around for a very long time. And so if you would share with us your experience growing up, and then how long you've been in Gambia and your transition as well away from Gambia to the United States, then we can, really walk into your studies eventually in the United States, and then eventually we'll get into the bigger matters as well.
No, thank you, Ibrahima. And yeah, it's funny that you've met my family before me, but I'm just really proud of the work that you're doing, and it's an honor to be here. I found that over the years, it's so difficult to explain my journey, because before I used to just start from when I was born. But I think I'll be remiss if I don't always take it a generation before, because as we grow older, you realize that who your grandparents were influenced who you were, in a sense.
Mm-hmm.
So I was born in Banjul, which in our generation, there's not a lot of us that say we were born in Banjul.
Yes.
But my grandmother, Aja Fatim Menga, was very prominent in AFDI. She was one of the confidants of the first president, Sadauda. So she was Yai Compton. She was one of the founders of Women's Bureau. So that's so much of my life. Our family history stems from that on my mother's side. And then on my dad's side, my dad was born in Bansang. Most people that are from Bansang know Badjie Kunda, right by the hospital, Mankamam Kunda. So that's from who I come from. The reason why I explain that is because loving nation, being part of a multicultural dynamic is embedded in who we are as people. So yes, but I was born in Banjul, but I don't remember any of my childhood in Banjul because of my dad's career. He joined the diplomatic force very early. So most of my childhood as an infant, we actually relocated to Belgium and then to New York. So my first recollection of Gambia is actually at the age of 7 when we moved back to Gambia at the time. And I actually only lived in Gambia from 7 to 17.
Oh, wow.
It's very interesting because, my childhood is in New York. So when I was moving back to Gambia in 92, that was 2 years before the coup, could not speak any local language. I was raised as, yes, Gambian, but like most of us that have children in the diaspora now, we're only Gambian by attire, and our parents speak a language that we really don't understand, but we could say Mangfi, Ibinyari, Ibinyang Dorong. You understand those small things. So moved back to Gambia, but was blessed to come from a great parents who instilled just values in me. So yes, Gambia, my experience. Schooling wise, Mrs. Ndaus until grade 9. And it was a family tradition from my father that we have to go to public school because so much of how he engineered our life was one to remove us from the USA and bring us back, because his mom used to tell him, don't lose your children to America. So they need to come home and learn who they are, learn the language. And for him, because he went to Armitage and Gambia High, mandatory ninth grade, you had to leave the private school's ecosystem and you go to Gambia High as well. So most of my friends, that's why there's a mixture where some people know me from Gambia High class of 2003, where I was the head boy. So most people knew me, but also just had a very rich childhood where learning your country, learning who you are, learning the local languages really influenced my childhood, and just being from a strong foundation of a very multicultural family. Obviously, my dad is Jola by last name, family from Buyam, but his mom is Mandinka from YBK. My mom is Wolof Manga Kunda from Banjul, but her dad is Serial. So oftentimes you'll tell people Santa da Be Nobanit. That's why it's
I
like
know.
where I'm all those things as well too. But that's just a little bit of my background.
Cool. So, damn, 17 you left, and then to New York,
Yeah.
and you guys lived. I mean, you from so after. So you when at what point did you come back to Gambia first?
Man, when I left, I was away from 2003, I think at least close to 10 years. I did not come back to Gambia as well. And I had a very immersive life, because it's funny. We came and it was like, okay, you guys are just coming to school and you're going to go back.
Mm-hmm.
And which is funny from a psychology perspective. So the whole time I was in Gambia, I was like, no, I'm about to go back anyways. This was just an experiment that my dad wanted us to do. So yeah, I left Gambia and I did not come back often. I came one summer, I think in 2005, because I was doing an internship at MRC, and I came again for the summer. But I really didn't come back home often. One, because of school, but just I just didn't have an opportunity to.
Yeah.
So I left. I really didn't start coming back as an adult until 2015, when I had already completed almost 10 years of schooling as well, but really didn't disconnected completely to a certain extent, But the family also was not home, because my dad, after a while, he was in Sierra Leone as ambassador, then he went to India as ambassador, then he went to China as ambassador. So we really did not have a home base in Gambia for some time. So that contributed to it, yeah.
So let's get a little bit into your academic training in the United States. You've talked about this in some of your previous conversations with some individuals in some media house or some podcasts, where I think you mentioned that it was never the plan to do pharmacy, for example, and just, I mean, you've always been about really into science. That's what you've always been. And I think part of what is ordinarily you've come from a household where either they're lawyers or diplomats, you just would want to do that. And but you choose a different path. And I think in your family, we could say that Aisha is the one who is still in the diplomatic area, right? She's still going hard on it.
Yes. And a lot of people don't realize how God works. Aisha, when she joined, she held the same position that my father had when she was born in New York. That's how full circle, life went around. But you're right. I don't come from a family of healthcare professionals. Nobody in my family is a doctor. And most of the times, anybody who chooses healthcare, you have an inspiration.
Yeah.
I tell people I'm an accidental healthcare professional, because the universe and Gambia told me I was a science student based on my grades. And naturally, once you become a science student, the expectation is engineer, or you're going to be a doctor or some kind of medical program. I left Gambia to study civil engineering, actually, because my dad felt like that sounds good. Go be an engineer. And I changed my major to chemistry when I got to my Tennessee State University, where I did my undergrad. I tell people Gambia High Science School is more difficult than freshman, sophomore year in most colleges in the university, because to this day, the WIAC exam is one of the hardest exams I've had to take in my life. So I say that to say that the first 2 years of college was child's play because of Gambia High Science class, to be honest, right? But also my mom, for people that know her, she's ran a business, a retail shop that my grandmother used to run at Albert Market. So we grew up around retail. But there's, certain patterns when you're a child. most people would have labeled me as having hyperactivity disorder because I'm always curious about something. I get obsessive about something, then I'm really ready to shift. And for me, I think that influenced why I did not choose fields that there's not a lot of flexibility to switch to something else,
Mm-hmm.
right? Because certain careers, I think it's unfair to make an 18-year-old child, a 19-year-old child choose a career that, especially if it's licensed, like you're a lawyer or you're
Yeah.
this, there's not a lot of flexibility.
Mm-hmm.
And that's how I approached when it was time for me to choose which medical profession I wanted to pursue. Medical school, once again, I've never had desire. I don't have a role model when it comes to that. PhD route was too boring for me in terms of doing research and my personality.
Mm-hmm.
But also because when you come from a household where you see your mother creating value, buying things, selling it, understanding business, pharmacy to me was the marriage between entrepreneurship and medicine, but also it was dynamic.
Mm-hmm.
That's honestly how I ended up wanting to go get a pharmacist degree. So I didn't even take it. In beginning of my school years, I did not know. But yeah, because I think once you're a science student in Gambia and you graduate, you could be anything in the world,
Yeah.
right? Anything in the world. So not that I don't I'm strongly passionate about, the healthcare field. I just feel like I had the foundations where I could be everything.
Yeah.
But the older we get, we realize that God really navigates what you do and for
Yeah.
how long you do it. Uh, and that's really how I've approached, my educational journey as well.
And to that specific point that you highlighted earlier, in terms of just how the struggles that you go through in Gambia and just how hard exams are and the things they make you go through, if you're able to overcome that, I think school here becomes somewhat easier, right?
Mhm,
Although in terms of the
mhm,
standards, they're different too. There are still certain areas that when you do in Gambia, you come abroad, you
mhm.
still need to adjust. Like it's insane,
Yep,
especially in terms of writing, in
yep,
terms of access to materials, in terms of
yep,
technology. Those are areas that
mhm,
eventually you work extra harder to bring
mhm,
yourself in alignment to the standards that are here. But in
yep,
respect to the foundations of just what you go through, the struggle, the want of books that you don't have access to, the night, burning of candles, you go through so much. And then you go
mhm,
that, standardized exams called GABESI or WAS
mhm,
exams, and then you come out
mhm.
of it. Then you come to America or abroad. It's almost like, yeah, this is really easy. You know what I'm saying?
Yep,
But
yep,
you went to
yep,
a really good school too. I think Purdue. I have a friend who actually went to Purdue as well.
yeah,
He did
yeah,
his,
yeah,
um, like tech training there and has a really good job here in
yep,
Seattle. He's Indian too.
yep.
So you have inspiration from your mom in terms of being around business and seeing, her involvement in retail as well. So at what point did you really realize, especially either during your studies or after your studies, you realize, hey, I want to do this, not just for here. Obviously you work at Walgreens. In case for those people who don't know, those are like really big pharmaceuticals. Like they sell really, huge amount of medicines all over United States and I believe around the world too. But you can talk to us
Mhm,
a little bit about that after you graduate, your professional
yeah.
work experiences, and then at what level do you realize that, look, I want to do this entrepreneurship thing?
Yeah, absolutely. I think once I decided that I was going to go to pharmacy school, I know I think there's something about being an immigrant where we're raised to say, okay, whatever they say is the best school, try to get into that school. So I literally just looked at the top 10 pharmacy schools in the world, and Purdue was there. I did not have any connection. But most schools, they ask you to take an entrance exam like the MCAT or the PCAT. Purdue was one of the few schools in the top 10 that did not require you to take an entrance exam, which is very unfamiliar.
Mhm.
But also at the time, they had a PharmD MBA program that a lot of schools in America did not offer, meaning they will teach you to be, a doctor of pharmacy, but think as a business professional because Purdue, like you mentioned, the institution is known for innovation, it's known for administration, it's known for technology. I mean, Neil Armstrong, the first man to walk on the moon, went to Purdue. So most people in Seattle, especially the engineering community, they understand that. So I got in, I was like, okay, I'm going to a top 10 school. But also, I started working as a technician at Walgreens when I was in. So I tell people I've worked every job in the pharmacy as well too, and it matters because 2007 is when was the first time I walked into a pharmacy and started working, right? So once I started my professional program, you know how it is, especially if you go to a school where out of 150 students, there was only 5 Black people in my class at Purdue, right? So like most things in America, you become the 5 superstars.
Yes.
That means you get opportunities for minorities, you get opportunities. So Walgreens and CVS, especially, they go to Purdue and they recruit because it's a top 10 school. So even before you graduate, these corporate companies are finding talent to sometimes also fit their minority quota as well. So it opens you up to a lot of opportunities where as soon as I graduated, within 6 months, I was managing a pharmacy 6 months out of graduating. So it goes back to, I think before entrepreneurship, there's apprenticeship. I started my apprenticeship journey so early, but very early in school, even my pharmacy professors know I did not want to wear a white coat for the rest of my life. So my professional track was actually pharmacy administration and entrepreneurship. Even before I graduated, the clinical stuff I'll always know. It's just books. And now with AI, they're becoming redundant anyways. But I started training on how to build health systems as soon as I graduated. And then, with God, alhamdulillah, in America, that's another thing that I think that's different in Africa. If you work hard, if you're smart, if you have good values, they'll give you opportunities. So very early in my career, they started trusting me with pharmacies that were, doing $16 million a year, managing $1 million worth of inventory. So like a lot of things, even professional sports, you do it so often in a controlled environment. You understand it at a very micro level where I'm like, okay, I could build this, right? That's where the buck came. And if you're curious, I think entrepreneurship is not for everybody. But you find out very early that I don't have joy in what I'm doing. I realized that being a doctor, the whole thing, it meant more to my parents, but deep down inside, it didn't mean much to me. I was always more excited about what's possible. And I think I got to a point in my career where you get there and I started feeling empty, right? I was like, okay, I'm under 30. I mean, in North Carolina, everybody knows me in the pharmacy industry. Every time I'm driving home, I'm like, my mom I still need to send metformin to my, something may happen. I think it's just that happened as well too. But I'm very fortunate to have received pharmacy leadership and experience very early in my career and did it really well, where it just built confidence to kind of start exploring what I could do in Africa, really.
That's incredible. So Innovarx, your business in the Gambia. First off, we really like to know what inspires the name, right? And what is the scope of the business as well, and how did you eventually come to a decision to set up a business like that in the Gambia, knowing fully well, you're not new to Gambia, you understand the dynamics of that country. When you're setting up business, some of the most important things that you always factor in is how secure is your investment. That's not new to only Gambia. It's not unique to only Gambia. It's unique to even the United States of America, which is the biggest economy in the world, right? And so you have all of these considerations, and a lot of people struggle. They have the opportunity. I mean, not the opportunity. They have the resources, but when they think about the risks that are associated with it, it makes them to sort of, change their mind. But you've done this. You've been doing this for how long now? For at least a couple of years.
Yeah, a decade, bro. I registered Innovarx in April 24th, 2015. I've dedicated a decade where every single day this has been on my mind. But 1992 is important, Ibrahim. I'm going to take you back there because I believe Innovarx was born in 1994. And I'll tell you why. So my grandmother, God bless her soul, my mom's mom died before we moved back to Gambia. And I think she was the impetus for my dad bringing us home, because every single time, as I understand, she'll tell my dad, Inyanta Dindingol Nati, X, Y, and Z, bring them home. And then she passed away, so I've never met my mom's mother. We did not know her. When 1992, when we moved back, then we got to know my grandmother, my mom's mom, Aja Fatim Menga. It always goes back 2 years later, she died at 56, right? And it's the first time I remembered actually death, understanding the concept of death, because when we moved back, it's like, okay, now we've reunited with my grandmother, and 2 years later, she's dead. You don't realize at that time that it's not normal for a 56-year-old woman to die from diabetes and hypertension, right? It's still when you get into the medical profession and you understand all these chronic conditions, where once I got to pharmacy school, I realized that, wait, it's not normal that I lost my grandmother at 56. So I almost reverse engineered all the things that could have gotten wrong, that could have prevented that stroke or could have prevented that diabetes going out of control. And I always tell people, if you look at what Innovarx does, I literally put a picture of my grandmother and I built an ecosystem around it
Yeah.
that could have given her the chance to be alive today, because she'll be in her 80s today. And you and I know, being 80 years old in America, you see 4 generations of families,
Yeah.
right? But also at that time, my mother and father were diasporans. So meaning my mom, my dad, every single month, they will send money back home to my grandmother and make sure if she was ill, you know, when she would tell my mom, Sumayaram bin Nehut, or, you know, when my dad will talk to her mom, Mero, Ebalo Ketanyadi, X, Y, and Z, there's no objective information,
Yeah.
right? So I literally decided that, okay, I knew at the time healthcare was changing because Walgreens was piloting where when I went to school. And God is interesting. They started using this community healthcare model, and they were investing heavily in terms of transforming pharmacies to do more than just prescriptions, but more primary care. Nurse practitioners in the USA were also evolving. So I took all that knowledge and said, okay, let me try to design a new solution to global health. And that's literally what Innovarx means. InnovaRx means a new solution to global health. And I realized that, okay, few problems exist. Most people are losing their grandmothers to conditions that are prevalent. Most Gambians in the diaspora, because I was a diaspora, my parents were diasporans, are sending back home money, but they don't know how healthy their family member is. But also at the end of the day as well, too, Gambia has had brain drain, where I realized that, and this is where I talk to diasporas, I only had one opportunity to sacrifice at the prime of my career, where it would not cost me as much as it would if I was 45 with a massive family, because just 6, 7 years out of school, I jumped. I don't recommend that to family members. But yeah, that's where the idea began. And I just started with all these ideas because oftentimes when we come home, we have these grand ideas until Gambia and Africa hits you in the mouth. But essentially, Innovarx was born out of that because I really realized that in as much as Gambia's health system is really trying, I know Gambians don't like hearing it, but Gambia's health system is one of the best health systems in the region. I know it's hard for us to understand that contextually, but there's a reason why hundreds of thousands of non-Gambian, Senegalese, Guineans, you know, Guinea-Bissau citizens come to Gambia for healthcare, and it's almost free, right? But just come back to contribute as well too, because my father instilled in us very early that you're gonna have to come and serve at some point. And if you know my older sisters, Fatih moved back and served, Aisha moved back and served. Yeah, so Innovarx was born out of that. You know, my grandmother, which is why when it gets painful, I realize that there's a lot of people's grandmothers that, you know, hopefully a 7-year-old child would have the opportunity to get their grandmother, get to know them a little bit better. And we're diaspora led, you know, so we understand that if Gambians are sending over money constantly, every person living outside of Gambia wakes up at night wondering how healthy is somebody that I love, you know, and I just jumped like most entrepreneurs do.
So how has it been for you so far?
Man, this journey, it's, you know, people say Innovarx has brought me closer to God. And to a fact, to a certain extent, it's true, right? Because Gambia, you have to be spiritually, physically, mentally, emotionally ready to do anything in Gambia. It's not sexy, right? If you notice, even people that come to Gambia, the easiest thing to do in Gambia is buy for this price, come and sell. There's nothing wrong with it. But it's a very simple business model. If you come into healthcare, it requires a machine. So Innovarx has changed me. It's been difficult in ways that only me and God know. It's tested my faith. It's forced me to lose everything. And then every single day, sometimes I wake up and I feel like, okay, this has been the worst decision of my life. But every single day, sometimes you wake up and there's one thing that happens. It could be through a staff. It could be through somebody in Basse getting their medications. And, our culture, they pray for you. You realize that it's worth it. And that's what entrepreneurship comes with as well, too. So it's been a hard journey. If you notice my business model, I've been building in public. And that comes with a lot of pressure, I've been built. I built in public. I fought in public. Triumphs. Everything has been in front of the world to see, and that has been a different path to building. Where most people build in silence, I chose the route of telling people this is my intention. I cannot solve all the problems of this country. I don't even want to be arrogant enough to feel like I could do that. But one thing I do is I understand the psychology of diasporans, and I understand health systems because I've been trained enough to be able to add value. The rest is God and people that have believed in us. But the journey, Ibrahima, it's some of my darkest days have been because of this journey. Some of my most uplifting days have been because of this journey. And like I told you, for 10 years, I've been grappling with this idea. Gambia, I've been here for 6 years. So yeah, it's been a journey to say the least, but yeah.
I mean, you don't have to talk about this too, but I was just gonna be specifically curious in respect to really what are the realities that encompass innovations as yours, as important as yours. Ordinarily you would think that would have an environment that, in terms of business framework, that would be very open and supportive to initiatives like yours. In fact, say policy-wise, the government could augment or complement what you're doing, especially a project that you're intentional about who your audience is, in terms of who can really look out for their family members in the Gambia, the diasporians, for example. But in terms of the reality of the business framework and environment in the Gambia, what would you say are like some of the biggest challenges that could really be reformed in some way to ensure that people that are in this position, that are making so much difference, like sort of feel supported, and also not, because you went through, you actually really went through a very public, in a way, experience with policymakers and government officials in the Gambia. And so all of that, I'm sure, builds you into who you are. So I think it's important for us to dive into that a little bit.
Yeah, absolutely. I often tell people Gambia is one of the worst places to do business in Africa because it has all the problems of Africa in a small market, right? Literally every single problem of Africa, Gambia has, and then it has a small market. There's more adults in some neighborhoods in Nigeria than they are. So it's a double whammy, but also we have a very unhealthy relationship with the diaspora in a way. It's very confusing because you could be a non-Gambian and have an easier pathway to do business in Gambia than a Gambian who's actually coming home. And I don't know, it's weird because they look at it like, oh, you shouldn't be here anyways. You are comfortable over there. Why are you coming to kind of get stuff that's already here? So it comes with that. But also innovation comes at a price. I think if you are a first to do something, you go through waves from our people. The first thing is like, who does this person think he is? Right? Yeah. So you get that skepticism. And then you go through like, just wait till Gambia shows him Gambia. He's not going to stay. And this is from a diaspora I'm speaking, right? And then you realize that, okay, the system is broken, not from a structural perspective, but it's a double whammy, right? I think it's funny because I don't say the government is not supportive. I don't think there's frameworks to understand people that are here to provide value. The way some countries like Rwanda, most countries that are progressing in Africa, they see their diaspora as the engine of growth in terms of intellectual ability. So they remove all the barriers. Gambia has a very weird way of making diasporans pay school fees to earn the right to exist. So it's almost as if you have to publicly be humbled, which is very unusual, before things start opening up. And there's a sense of sport in it, as if you have to fucking moon or go through something, and it becomes easier, not realizing that most of the times we are sacrificing our entire life, but also some of the decision makers who really impact the lives of individuals have never really sacrificed something. That's why it's important when you have builders who are decision makers, because somebody who's created something from scratch understands the value of time, money, and loss.
Yeah.
If somebody doesn't come from that mindset, them delaying whatever process a month and a half, don't realize that most businesses in Gambia cannot survive a month and a half, right? So there's a lot of structural thing, because also there are people in the government that actually support the idea of what you're trying to do, but they don't understand the systems that are required to make it easy for you, right? And the biggest challenge too, you can't find talent. One of the biggest lessons that I learned in this journey was two things. Whatever amount of money I thought I set aside was not enough. I underestimated how much I was going to lose in terms of my earning potential, because once again, you're in Seattle. Anybody with a PharmD degree, every literally 5 years, 5 to 7 years, you're losing close to $1 million of revenue from payroll perspective. But also you work in an environment where team is everything. If you don't have human resources to execute, you could have the best idea in the world. It's going to be 10 times harder, right? But also it just takes systems, because healthcare in Seattle, especially, the government is the biggest payer. The state is the biggest payer of healthcare. In Africa, the state does not participate in paying for healthcare. So if you build a business, you rely entirely, most of the times, on the diaspora and the small minority of people that could afford it. Because if you build a healthcare system in an ecosystem where people believe in $25 a ticket at Edward Francis to get everything, even if you sell them something that the value is $1,000 and you sell it to them for $100, they come from a mindset that I pay $25 at Edward Francis and I get $300 worth of healthcare. So you factor all those things and it just becomes almost mission impossible. Or sometimes Gambia, you could come out wanting to start a business and they'll turn you into philanthropists because you wouldn't make money. From family members to just the ecosystem. Everybody assumes that because you're on social media, you're a millionaire. Because when we were younger, a rich people starts a business. A rich person, meaning they saw that you own a business, you're rich. In the USA, it's like, no, you're a startup, you're grinding, you're building a product, right? And then you slowly build it to create value, not to really preserve wealth. And from a policy perspective, man, listen, I learned I could write a book in terms of how laws, policies could impact the lives of people. Ibrahim, my business should have died last year. I went the entire 2024 where I could not bring in medications into the country. Think about a business where every single thing around healthcare revolves around two things. Either you're going to need a procedure or you're going to need a prescription. Even in the USA, if you look about healthcare, I tell people, if you understand how healthcare works, there's first principles, things that are undeniable, right? Every human being needs to be maintained. That's true wherever you are. Illness and injury is inevitable. Every single human being is going to be injured or will be ill at some point. That's first principle number 2. First principle number 3, once all those those two things happen, you need access and continuity of care is the only way you could get better. Any system, you need access, you need care and continuity. And lastly, dignity and trust. If it does not exist, nobody buys your business, right? So healthcare is very simple. So if you have an ecosystem where you're a disruptor, because some people will label like, I brought a disruptive model to Gambia that changes the status quo, because when we were going up to school, we know that the pharmaceutical industry was owned by a very select few people that owned the Gambia. Before Innovarx, there was not a single company that had a direct pipeline of bringing in medications in the USA that I used to dispense in Walgreens to the Gambian people. When that happens now, you and I know that when we walk into a Walgreens or CVS in the USA, we never think about whether or not this is quality. We know the medication has been prescribed to do what it's supposed to do. At some point, you realize that, oh, you're going to make some enemies because what you're trying to do, for example, sell 1 year worth of medications for somebody with diabetic and deliver it anywhere from Banjul to Basse, and you're charging them $100 up, $100 for that's gonna cause a problem in the ecosystem. And like the problems of Africa, unfortunately, legislature is manipulated sometimes. Lives are lost in the process, and then one shift could remove you out of business, because Gambia also has a history where if you see a Gambian wanting to do something, don't fight him directly. Change the rules of the game, and they're going to die out. And so many people before Innovarx, be it in importation, every sector, there's a mechanism of control that the technical people who are supposed to advise our decision makers, if they are corrupted at the technical level, even the best president in the world would receive bad information, because the people who should be telling him this has an impact on that, it does not happen. So that's why decision making, I always tell people, even from a political perspective, the National Assembly is more important than the executive.
Yeah.
Gambia is going to change in legislature more than it's going to change in executive as well too. But it's just been painful because you go through that and a part of you dies. You start seeing your country differently. You start questioning, even family members are affected. Yeah, it's no secret that, half of my family has been in the USA. And you just start looking at the country differently, especially if you've put in so much as well. And you live in Seattle. Some of the people who invested in the company live in the USA. They're Gambians in the diaspora, Africans in the diaspora. So it's very difficult when somebody trusts you, bestows you, gives you money, and then you could be the best executor, but you chose the wrong country to execute, and you just pay the price in a very expensive way. So yeah, and then you do it in public, where now there's misinformation, there's defamation of character, there's so many things where I feel like it's just unfortunate that oftentimes Gambia, where a land where it's so much easier to destroy something you did not help create, it's so much easier to criticize something that you don't know how difficult it is, and we do it to our own people, Ibrahim. That's the unfortunate part, because last year I was traveling across Africa with the Stanford program. Everywhere there was like, why did you choose Gambia? You could do so much great in other countries. Right? Allah knows best, but alhamdulillah, we're still around.
Yeah. And honestly, I'm not going to lie, bro. When that shit was going down, excuse my French, for most of us watching from afar, including some of the, like the young people that you inspired into pharmaceuticals here in Seattle, like the young Ismails and also more in Ohio. Like we really got into it, just how much of, I think part of it is also, I think Gambians are not used. Well, I don't even know whether it's right to say Gambians are not used to, but there's a complexity that also comes with accessing a certain level of success in Gambian community and society, and exuding a certain level of confidence as well. And I'm talking about this because I go through this myself. Being this way, carrying this, like being so confident on social media and putting my workout stuff out. And just this almost incessant idea of somebody trying to bring you down, for you to humble yourself, to make yourself small. And the reason I'm bringing that up is because, I see you do so much. Bro, you literally every weekend somewhere having a discussion about health and wellness in Africa. You don't only talk about Gambia. And so there was a time that just subconsciously or intuitively, I was just like, yo, I'm beginning to worry, because I know how Gambian people are. I know how our psyche really is. So I think in many ways it also contributes. But there's another fundamental area that I think is happening a lot in Gambia, which is, I think, lobbying, right? And just certain individuals, very small part of our country, own so much, right? And so to have almost like you put it very greatly, to have almost like a disruptor who comes into the system, you're going to
Yep.
face a lot of resistance.
Absolutely.
And so for most of us, for watching from outside, we're just like, damn, like this guy is doing something so unique, and then this is what he is going through. Not to say that, like obviously everybody wants accountability. If there is anything that you're doing that is not in compliance with law, whatever, cool. But to make it as though that you're subjecting this guy to all of this public, I mean, it's indignify. They literally indignify you in many ways publicly.
No, what you should call it is defamation of character. Is also building something that they did not contribute in, because sometimes they assume that it's easy to arrive or achieve anything in the USA, because there's this notion that sometimes, because we're coming from the diaspora as well. They don't understand that a professional like myself that dedicated, literally, I was in school till I was 28 years old, right? And then I added a career on top of that as well. You just cannot do certain things and it's okay. It's just another day in Gambia. And you were speaking about it, where we just try to break things down. It's something about us that it's so easy to break things that belong to us down, right? But also, I think for me, the path that I took was, if you know your truth, you're never afraid to speak it, even if short term people will doubt who you are.
Yeah.
Because I've been of the mindset that lumaiwa, it's not orthodox, because once again, America, we come from a school of you tell your story. They teach you how to communicate. They teach
Yes.
you how to sell your idea. They teach you, because if you're not fraudulent, you're not afraid of what you say, right?
Yes.
It's not. So you go through a very difficult time where, even if you notice, I knew that this was also coming, where I used to talk about things that will happen before it actually happened, because I understood the dynamic in terms of just, you're going to go through a painful period as well. But also, I knew that what I was saying was true,
Yeah.
and I was going to be vindicated, because I never did anything that I felt like would be difficult.
Mhm.
And alhamdulillah, even now as we speak, there's a lot of things that's going to be coming in the upcoming weeks that a lot of people will understand, that even most of what we were fighting Gambian people, because there's an inherent attitude that I believe Gambia is ours, and we sometimes will not be given the opportunity to build. We have to insist on our right to build. And if we do it the right way, the beauty about Gambia is so small that if I am doing something nefarious, you just said it in the beginning, you know my father, you know my mother, you know my sister, I cannot hide in Gambia. A non-Gambian could pack their stuff and leave Gambia and we would never know them. Which is why I think we should encourage Gambian builders. We should encourage Gambians who are building for the country, because there's a sense of communal accountability, where if you do something bad, and even your grandchildren will remember some more phone. It's just a self-policing mechanism, but it's unfortunate, but it's painful part of growing in a society. I think it shouldn't discourage people. I think if you're doing things the
Yeah.
right way, Allah will protect you. Allah will vindicate you. I tell people all the time, us as human beings, what the people of Mecca did to the Prophet could never be, what we go through day to day in our countries in Africa, we're trying to build, it could never amount to that. And he's the best man who ever lived. So who am I, this, humble servant of God and, honoring the messenger, to feel like I'm high and mighty to a point where I'm immune to difficulty? Because I also do believe sometimes going through something hard will test you to see, are you really about this mission?
Yeah.
If I didn't care about Gambia, I would have left.
Absolutely.
If I was doing this for profits, I would have left. Gambia, actually, the business that I chose is the worst kind of business to go into, because you're not going to be profitable for a very long time. Things in Allah's hand, but for everything that you go through, I feel like there's good happen. And I'm always fair, Ibrahim, and I'm glad you're measured. Even when we talk government X, Y, and Z, there are so many people in the government that even at the worst hour, even if they cannot do something, they will call me and tell me, please do not give up. just stay, things will get better. Right. So I'm always objective as a diaspora because we have to be careful in painting a narrative as if nobody wants us to exist. No, 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 no. If
No,
anything, the
totally.
people that made my life the hardest are people that would never show up on an election box, people that just do things because of scarcity of resources, honestly.
No, totally, totally. It's hard, man. I always think about it a lot. A lot of us, especially the young ones who we just left not long ago, we're still trying to figure out our ways. Find it. Find our feet. But eventually, all of us want to go back home. Gambia is home. Africa is home, and you're big on that. Anytime I listen to you, you don't limit the scope of your conversation to just Gambia. You're always like, the idea is Africa. Africa is what we value. That is what gave us so much. It's our identity. It's who we are. It's what we represent, and that's important. So for me, that's always like, look at what's happened in Senegal in just few days ago, bro. The diaspora investment initiative that they just did. And so when I look at stuff like that, I'm like, okay, there is hope. It's not like in terms of at policy level, it's everything that they're getting wrong. There are certain things absolutely that they can do better, right? And there are sort of pilot programs to see, like either nearby, next to Gambia, or even within the Gambia, that we can look at and say, okay, maybe we can scale this up.
Yep.
And so I think about it a lot. When I look at that news from Senegal, I'm like, damn, Gambia needs something like this. It's not, our diaspora is almost so isolated that the only way they're connected to Gambia is through remittances, right?
Yeah,
and
remittances.
So I wanted you to talk about it a little bit.
Yeah, and remittances don't stay. We don't pay attention. Most of the remittance leave Gambia by the end of the month. Gambia is a transit for remittances because if you think about the economy and how it works, you have to have off-takers, right? Inflow, off-takers, absorb it. Off-takers, products or services. Just think about how many industries in Gambia are dominated by Gambians as products and services. Meaning for every $100 that comes in, find out if that $100 is still circulating within the Gambia. And what I mean by that is if you send products for your medications for your mom and you go through Innovarx, that $100, part of that $100 is what? $7,000. Let's say that's now 50% of one of my staff members' salary. So that money is circulating from you to the service to that staff member. That staff member takes that $7,000, the $2,300 that he goes to buy a bag of rice. Is that person a Gambian? And that's what I mean by how money circulates in an economy where it stays in the community longer. So remittances are not staying because what people that are non-Gambians know about Gambia is that for over yomba. Just be positioned as an off-taker for products and services, which is why if you realize how they come into our country, and I'm not xenophobic, but man, we've struggled too hard and our parents have struggled too hard for us not to open our eyes and see what's happening. That's why commodities is a sweet spot in Gambia. Building materials, 53% of our remittances goes towards building materials. How many Gambians are off-takers of that 53%? So out of that 53%, maybe 3% is staying in the Gambia. So it's just a matter of awakening, but also even some countries like, hey, if I'm Chinese and I go to a Chinese community and open Innovarx and there's a healthcare service provider that's Chinese, you think the Chinese people are going to come and patronize my business? It's impossible. But Gambia, we flow without paying attention where it's going. And our family members are also not being intentional about Sumadala CBC Gambia and recognize them because that's going to impact them a little bit harder. So I think we need to open up our eyes in terms of how that is flowing, especially in the diaspora. But in terms of talent, there are so many Gambian businesses that are going to die in Gambia, not because they don't have a visionary leader, not because their idea doesn't solve problems. They're going to die because the ecosystem is going to suffocate them as well. That's why I mentioned the other day that some of us now, we are planning to leave Gambia, not even fully, because we'll still serve to spread our wings to the region, Senegal, Mali, Guinea-Bissau, Conakry, just to be able to protect our investments, because if not, we would not make it And that's just the reality of it, because it's just, we got to play the Africa game. We have to play the Africa game.
Before
Because
we
Gambians
shift,
could dominate in other countries. They're going to other countries and they're dominating. And there's some people, you know, the Sehu Balajas of the world with AB Blinds, you know, now he's in Sierra Leone. There's people that are looking to Senegal. So it's just one of those things where, especially for Gambians in the diaspora, I tell people I don't recommend it, because you're going to lose so much. It's going to break your family dynamic. It's going to break your friendships, your financial security. And one Gambian could decide, just because they have the power and you shouldn't exist, everything could go to smoke, you know?
Yeah, it's unfortunate and it's sad. But the last question I wanted to ask in respect to the business is, just so our audience know, especially those who watch us from, I mean, in the diaspora communities, and you do a great job in terms of your social media campaigns and stuff. And also specifically, you recently signed a partnership with. Yes, I think we should talk about it a little bit, and then we can talk about the services.
No, absolutely. I think we understand that healthcare should be a symbiotic relationship between private sector and public sector. We go as they go as we go. Especially when it comes to pharmaceutical availability. Most people don't know 70% of the medications that are brought into the country are private sector, meaning the government allocation is only 30% out of what the country needs to survive. So, which is why Gambians should go into the sector, because we have 70% need that is private sector as well. But if you realize as well too, now, alhamdulillah, Gambia is actually getting some specialists who are really sacrificing to come to Gambia to practice, the likes of Dr. Keba Mare and Dr. Jaita, the two Lamin Jaitas, one cardiologist, one surgical oncologist, Dr. Jabang. We have an ecosystem of specialists, but there's one of those for 2.5 million people. So what we decided in Innovarx, because we exist in a space where we don't do critical cases, we manage people with chronic conditions. There's also a need for medical tourism. Some of the things that we cannot do, we now have an ecosystem where we could facilitate them going to a treatment center, if it's a surgery that cannot be done in Gambia. And then when they come back, they enter the Innovarx ecosystem for protection. So that's really the partnership that we signed with Florence, which is the biggest hospital in Istanbul. Everybody knows now Gambia to Istanbul is closer from a proximity perspective. But what it does, it really creates a cushion where wherever we lack in specialists, we could now connect Gambians to a place where we facilitate the service, but also when we come back as well too. So that's really the way we position that. We've tried this model with some Indian companies, super specialty companies, but the distance is far as well too. But we believe in two philosophies. If a Gambian consultant could do it, that's our first referral. Because I think our consultants, you could take them anywhere in the world and they'll be the best consultants. But there's still a portion of the population now that we could help facilitate medical tourism. Now some of the Gambian nurses as well too, and even Edward Francis could now get training opportunities. So we built it. Francis Small would benefit in terms of the hospital going to Turkey for training, advanced training, and coming back. So we're going to look at nephrology and cardiology as well, but also in the private sector, make sure we just strengthen relationships as well. So you just do what you can, because once again, most people think we're rivals, but we have to work in a way that we support public sector, but also they understand the value that we bring to the table, because Gambia just doesn't leverage and utilize our private sector. And it's not Innovarx. I said Innovarx has always been one of the most underutilized vehicles in the country. And there's a lot of versions in a lot of sectors where we're just not utilizing people that could help, push the needle a little bit forward. But that's what Florence partnership was. And I think it's just a great opportunity for options now for Gambians.
That's really dope, bro. Congratulations, by the way, on that. I think that is big. But specifically in respect to the business in the Gambia, has the service changed? Have you guys added more areas of focus, or still specifically it's just managing people through preventive care service?
So massive change. We're even in the expansion now, where we have now clinics in Basse, Soma, Birkama Ba, and Bara that we're rolling out this year in 2025. And as you know, our business model, we're still the only that I know of healthcare company that is based in the Columbus that is still catering to people all over Gambia. And I always mention that from a diaspora perspective, meaning you and I have lived in the USA. Obviously, a lot of the work that we do focuses on capturing people's health status as early as possible and building a treatment plan that gives them continuity of care all year round. And obviously, that will include medications as well. So, for example, if somebody's mom is in Farafenya, for example, and they're diabetic or they're hypertensive, they'll need one medication every single day for the rest of their life, most of the times, to prevent the downline complications. That's why when we talk about healthcare subscriptions in America, they understand it. But any American, you live in Seattle, if you tell them for $100 a year, somebody will get the right diagnosis and take a medication to your doorstep anywhere in Seattle every 28 days, you understand the value. So a lot of the work that we do, it's still in that chronic disease before it gets to hospitalization or early death. There's a logic behind that, right? If you look at the Gambian demographic, I'm glad you use health tech to describe the company. Innovarx is really a data company. We, over the past 6 years, have done so much research in terms of understanding the prevalence of diabetes and hypertension, where I could comfortably tell you that at least 3 to 4 Gambian adults out of 10 already have a chronic condition that requires continuity of care all year round, right? Meaning these people either have abnormal blood pressure, abnormal blood sugar. So for people in the diaspora, just think about it. For every 10 people or 4 people already need care, that if you do not start taking care of them now, it's going to lead to downline where you need a Florence as well too. And the Gambia is young. So if you look at our business model, I come from a school of thought that I don't think you need 500-bed hospitals to have an impact in healthcare, right? Because Gambia's, 60 to 70% of our population is under 35. How many 16-year-olds, besides, motor vehicle accidents, which is increasing and it's a problem, need a hospital bed? Majority of the people fit within the window of maybe 25 to 55, that they just need to find out if they have a chronic condition, because more than likely lifestyle conditions, genetic conditions. That's what Innovarx is really good at: capture and keep. Our business model, even how we help the diaspora, capture your loved one as early as possible and tell you, Ibrahima, your mom is here. This is what we need to do for her to prevent her from being here. Here is $100 now. Here it'll be $5,000 for one, and then we all know that you are the breadwinner. So all the products or services that we offer, not only to the diaspora, is to capture your loved one's health status as early as possible and keep them as long as possible using a treatment plan, last mile delivery. And yes, now, we're really going to expand our reach in the rural areas as well. So that's really what we do extremely well. And then we do it understanding that most diasporans are not, pulling money off the trees. So we create flexible options. We've rolled out a health savings account program that's been transformational, because how health savings accounts works in the USA, because it's just money that's there when you need it.
Yeah.
And it creates a transparency where if Ibrahim, let's say you have a compound of 10 people and you're in the diaspora, you tell them, you know what, I'm putting $300 in this bucket. Now I know it's only going to be spent on healthcare. And then at the end of the year, if there's $200 left there, next year I'm starting my balance with $200 because I know it was not used. So don't call me at 3 a.m. in the morning, tell me somebody is sick. Just go to Innovarx, they'll take care of it. And every single time, because of the technology that we use, that the sponsors now understand exactly what's going on. So that's the sweet spot that we're going to stay, because if you tell me 40% of Africans need continuous care, that's why healthcare is like over $200 billion industry over the next 10 years, because first principles, every human being needs continuity of care, and injury and prevention is. So a lot of things in the beginning, I think because I'm a pharmacist, they thought I was just running a pharmacy, which was fine. But what we're building now is really a health ecosystem that we've built as well.
Well, I mean, we have a couple of questions which we'll try to get to
Yes.
before we leave. We'll
Yeah.
definitely answer some of these questions. There's one for
Yep.
Farafenye, and there's also one for, he wants to know those who are in Gambia who don't have access, I mean, who are not in the diaspora.
Could I answer that question for
Yeah,
Mr.
sure.
Judge?
Sure. Go ahead.
If you've noticed, Innovarx has been intentional about our corporate social responsibility since we opened, right? It's something I'm very proud of. No Gambian since we opened has ever paid to check to see if they're diabetic or hypertension. We've been doing that for 6 years. So how we help people at community level is we build these networks with community elders, community, even diasporans now are calling us and telling us, my village, can you organize a health screening event for my village just so that we could know the assessment? So we have a very grassroots approach. So even if you're not in the diaspora, if let's say you're from Gunjur or let's say you're from Birkamaba, we go to the community, we screen every adult who's available for diabetes and hypertension. And then we know that the 30 to 40% are going to need continuous care. So when you look at healthcare, how healthcare spending happens, typically you have three players. Government, Gambia is not yet. If you have a job that have health insurance, they could be a payer. If you have a family member in the diaspora, remember, we've met you in the community and we've helped capture your healthcare status. We facilitate the conversation with somebody in the diaspora who may be willing to pay for you if you cannot afford paying it. But because I had experience in the USA building subsidized programs and formulary design, most people in the USA know about the $4 antibiotic program where at Walmart, when you go, most antibiotics are always $4. We have a similar subsidized program for healthcare where $300, we've benchmarked 1 month medication for about 45 medications that are critical for it to be $300 that we deliver anywhere in the Gambia. And everything ties back. Think about how problematic that is in an ecosystem where most healthcare facilities, they're actually not in the business of finding solutions because it's a profit commercialized industry as well. But that's really how we help people. We go to the grassroots, give them their health capture moment, and then we help navigate, okay, how are we going to find the most flexible way for you to pay for the plan? So if you now have a loved one in the diaspora, we do the connection in terms of, Ibrahima, we saw your mom, she's doing, but did you know she was hypertensive? But, we need to put her on this treatment plan. These are your options. And then we will do the at-home visits for some people. We would do the delivery of medications, but we want to take you on the journey. That's why we believe in companionship. We want you to know every time where your mom is. Your mom needs to buy into the treatment plan. And hopefully, if we do it really well, based on how we designed Innovarx, we prevent two things: hospitalizations and early death. So even from our medical related people on the call, the two primary outcomes, when I assess how well Innovarx is doing, are we preventing hospitalization? Are we preventing early mortality related to a condition? But diaspora are the payers. So on average, every year, about 50% of our revenue comes from Gambians in the diaspora. But also they expect higher level of, customer service, which has been an interesting dynamic for my team on the ground to realize that the world we come in America, if we're paying you for a service, they're not going to wait at 10 o'clock for you to eat breakfast. They expect at 10 o'clock that medication is going to their mom. So that's been a very cross-cultural dynamic to manage as well.
Yeah. So, I mean, if anyone is out there who is really thinking about it, feel free. Ismail is very, his social media accounts are very active. They also have a website, and I mean, they're reachable in any of those platforms. So reach out to him, reach out to his team if you're really looking to really, find ways and means to help your family back home. But if you're also in Gambia, you've also already heard him say that they're offering free screening for diabetes and other things in the Gambia. But to move away a little bit, you do a lot of health advocacy and awareness in the Gambia. You do a lot of talk shows. People are inviting you to everywhere. I don't know how you do it, but it's pretty impressive. And you also, managed to build such a huge following all around your social media platforms. And also fitness and wellness. You've always been big on that, I think, for as long as I've known you. In fact, I think that's one of the even before I knew anything about you, that's what I used to see.
Yeah,
You used to do a lot
yeah,
of heavy deadlifting. I'm like, damn, this guy, because I was never into deadlifting like that,
yes,
you know.
yes,
But
yeah, 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 common.
yes, we do. But I was gonna say that recently you made a really incredible. You had a very important conversation around HIV at the camp, I think, with some of your colleagues. That's a great program, by the way. I'm a big fan, you know, and
Thank
you
you.
guys talk about very important stuff that ordinarily Gambians shy away from, including one time you also brought sugar and the quantity of sugar that goes into attire. And, you know, I
Yeah,
was just blown away.
yeah,
I was like, okay, cool,
yeah,
this is important. But I think the HIV one was one that really struck me very hard and deep because I know just how severe that looks and how that sounds and just how people
yeah.
are nonchalant about stuff like that.
Mhm,
But talk to me generally about the state of health in the
mhm.
Gambia, but especially sexual health and sexual education in the Gambia and what people need to do to be really protective from things like that. Seems Ismail is experiencing technical difficult internet problems again. Peter said,
Yeah, no,
"Oh,
I'm
it's here.
back. Yeah.
Okay, cool." But yes, specifically
Yeah,
that
so
part
I
of
think
the discussion struck me.
in HIV, advocacy, and it's funny because most people, just because I came home as a diaspora, they maybe did not know me in high school. I think in Gambia High, I was into everything. So I was actually part of Buffalo when I was 16 as a youth advocacy person, going into communities, doing HIV, STD sensitization. So I've always done advocacy. And sometimes, if you know where somebody's from, a lot of what I do now
Makes
is
sense.
related in that. But I also believe that education, as healthcare professionals, they don't train us with soft skills sometimes to explain things in a way that people could understand, right? I realized even one of my impediments in the beginning when I came home, I was always speaking English to communicate to people, and I was leaving behind so many of the population where if you speak a man's language, they understand it better. But Alhamdulillah, I'm able to break down very complex things where people could understand it. So that's really how Kampe Jambar was born. And we look at it in terms of what people don't want to talk about, but need to talk about, especially if you have empirical data to tell them, I'm not telling you this is a problem, right? I'm not trying to be an alarmist, but a lot of us think these people don't exist in our societies anymore. And for the one for HIV in particular, because once again, people don't understand that when I was in the USA in North Carolina, my store was managing the HIV contract for North Carolina. So I was dispensing 1,000 medications a day, and the state was paying me just for HIV care. And I realized that Gambians had forgotten about HIV. But when I looked at the data, because now we're doing work in HIV, we're actually doing capture and keep, we're testing, we're treating as well. I'm like, most Gambians, if you talk to them about HIV, they have no idea that this is still around. And
Mhm.
not to be an alarmist, but if people are not aware about it, you're either infected or you're affected. But also, I realize there's so much misconception around where HIV care is today, where I think at some point I had said, hey, if I had to choose between diabetes and HIV, I'm going to take HIV because Gambia is one of the few places in the world where HIV care is free of charge. And once again, if people talk about, I'm not saying this to even butter up the government or do anything like that. Gambian healthcare system is actually one of the best healthcare systems when it comes to access. It's relative. Could it be better? Yes. But most care, especially HIV, is completely free of charge. But the average Gambian doesn't know that it still exists. The average Gambian doesn't know that in our general population it exists. In our key population it exists. We don't have to be an alarmist about it, but the same way we should be guiding ourselves, because if you have a youthful population where 60 to 70% of your population are young, sexually active, all the things that we see in Gambia, drug use, youthful population, HIV, all these things, youthful population.
Yeah.
We need to start changing the way we bring awareness out, not to scare people, but to enlighten people. And it does get exhausting, Ibrahim. You're right. Even my wife sometimes will tell me, break off social media. But at the same way, it's in a weird way, it's a form of worship.
Yes.
And that's why it ties to fitness. Like, you know, that if you could, it takes discipline to do anything in
Yeah.
fitness. But if the whole concept of fitness is creating discomfort to grow, but we know, because I mean, you're doing it way better. I've never been as big as you would, right? I think
No,
you're at
but
the next level.
no,
But
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 I don't have your endurance, bro. That's crazy.
but
What you do?
but you but you understand that fundamentally fitness, because of technology, we've gotten so lazy that we have to create artificial discomfort to grow. So if you look at how hard I train, how much I expose myself to discomfort, I tell people I'm training for Gambia. Because if I was soft and was not used to discomfort that I induce, Gambia will break me as well. But you do get exhausted as well too, because every human being is like a charged battery. So you're always giving, you're always giving, you're always giving, you're always communicating. And every time you speak, sometimes you'll talk about things that people don't want you to talk about. Some people like, this guy is everywhere. But who I'm speaking to oftentimes is people that, at least in this day and age, media is free, right? Distribution is free. You don't have to buy content. Ignorance is no longer an excuse. So everybody who has value and knowledge to share, if you have an opportunity to do it, especially for the community in the language that they speak, and you're doing it with the right intentions, not to sell a product,
Yeah.
but because, once again, information is scarce. But also, Ibrahima, you and I know, that's why I'm really glad the dialectic space is happening. We're consuming too much nonsense
We
as a
are.
country.
Yeah.
If you look at the quality of, honestly, garbage that our people are consuming, it's because the people that should be speaking are not creating enough content, and people are going to consume regardless. It's either 1 hour of listening to dialectic space, or it's going to be 1 hour of looking to TikTok of a cat playing a piano or somebody doing something crazy. People are going to consume either
Yeah.
way.
Yeah.
But you know, if you understand business, my motto has been social media evangelism.
Mhm.
I don't have to pay a lot for advertisement, because in this day and age, as you know, everybody is a media house.
True.
And it protects you in a way, because I want Gambian people to know me, who I am, what I am about,
Mhm.
because my journey has been in public. I'm going to continue building in public. When I fail in public, I will understand, I will communicate with people, because that's who I am and I'm comfortable in that space. It may not be for everybody, but you know, and when I'm tired, a day will come where I'll disappear from the face of the earth and go sit in an island somewhere and just get off social media.
Mhm.
But we all have one life, man. You know, we
Yeah.
do what we can. We worship God through our work. And then when we can't do it anymore, at some point I'll have, you know, families and kids to, you know, prioritize. I could look back and say, even if it's not success, that I did my best and the Gambian people got to know me, the person I was, the imperfect person I was.
Mhm.
And I just contributed a little bit, and then we'll leave it for the next generation to do it, you know?
And I sincerely think that for me, in many ways, would be symbolic of your legacy. You know, is you gave it your all, you gave it your best,
Mhm.
you gave it your heart and your soul because you believe in it,
Mhm.
and that's something that you can go to bed at night and sleep knowing
Mhm.
fully well that you have absolutely nothing to regret. And I live
Mhm.
by the same philosophy too. Is hey,
Yep.
I'm not doing this yet. The bigger purpose, the material incentive is great, but that's not my biggest
Yep.
motivation. It never has been. It never would be.
Yep.
I do these things because I know what I gain out of it. It's almost like you said. It's almost like it's a prayerful.
Yep.
It's a call to submission for a purpose greater and bigger than yourself. But
Mhm.
finally, Ismail, before I let you go, is I want to really ask you, what is your call for hope? In this time, a really very trying time, I must add, in many
Yeah.
shapes and form, not only for Gambia but around the world. What really keeps you going?
Um, it's such a good question, because there's days where, even from within, if you live in Gambia, you're searching for something to be hopeful for. But fundamentally, I also believe that Africa is going to win. And I'm going to shift from Gambia, because I have a very radical view when it comes to nationality, sovereignty, which I'm just going to keep it in terms of what I believe.
Yes.
I think that the world is moving towards Africa. I feel like Africa is so young. The average age in Gambia is 18 years old, man. Right? Me and you, we're not kids anymore. We have a responsibility. We really have a responsibility to the younger generation. And Ibrahima, you realize it because now you're a face in public. And every time when you go out in the streets and you see a 10-year-old boy or you see a 10-year-old girl, and he tells you, you're a source of inspiration or you're giving us something to look forward to, it's a heavy burden.
It
But
is.
you realize that, like, yo, we're doing it for them.
Yeah.
And they will also, our children will ask us, no matter where they live, what did you do? If it's good, they'll understand that you did your part. If it's bad, our generation will be a failed generation. To be difficult as it is, we owe it to the kids behind us to give them a reason that things will be better than it is now, right? And every now and then you see glimmers of hope because I feel like if you look at Gambia through just a prism, it could depress you.
Mhm.
But if you travel in Africa and you see what's happening on the continent, it is undeniable that we are going to win the long game. The future is Africa, which is why I tell people as much as we love Gambia, as much as I love Gambia, no person should play the Gambian game because it's going to be disappointing and very difficult.
Mhm.
We should look at the Africa opportunity because I am hopeful Africa. I'm a Pan-Africanist, such thing as a Gambian anyways. I love the country, which is why the season that I know we're going to be doing a lot of hoopla. I tell people, regardless, we need to keep on building Gambia
Mhm. Yeah.
because our problems only we are going to be able to solve it. So that's what gives me hope. The young people that we have a responsibility for, and I just believe that Africa is going to be the future, and then we'll play a part in it, And Gambians are, if we're great everywhere we go, there's no way that things won't be a little bit better. But I think young people need help. If you live in Gambia, man, it's scary. The amount of
Yeah.
young people, the direction that it's going, unemployment is very difficult, man. We really have to buckle up over the next decade collectively and just try to see how best we could make this country a better place. And that's independent of politics, because I know we focus so much on that sometimes that we lose focus on non-Gambians that don't care about politics. They're harvesting money. So for the
Yeah.
next 10, 12 months, they're just collecting money while
Yeah.
we're talking, fighting each other, and then they take the resources elsewhere. So that's really what keeps me hopeful. Africa, man.
Yeah. Oh, Dr. Man, you're so inspiring, so aspirational, indeed, very prudent conversations as well. And thank you so much for being here. Thank you so much for giving me your time and to really sit down and have a conversation. Like you said, it's been a long time coming. And I hope I can have you more often as well for us to really get into issues that are really bordering on the lives and livelihoods of Gambians, especially in respect to health. So I really appreciate your
Absolutely.
time, and thank you so much.
No, thank you. I'm proud of you as well, too. Honestly, I was so proud when I saw you finally transition to really owning not only your voice, because I think there's mutual admiration, and I think it's always a good sign as well. As fellow Gambians, man, when we see each other doing something good, I think we connected on the fitness tip. I've always been proud of you, but especially now you're a voice and you're amplifying our stories, and it's positive, So please keep building because I think in this day and age, it's so easy to be very popular or have a platform that just tears people down. But I think you've been very intentional about just building with like-minded people. So I'm also very proud of you. I want you to keep on building this platform. Hopefully you also are part of the inspiring because there's people in Gambia that do look up to you. And you live in a state that's very near and dear to my heart. Seattle there's so many Gambians in Seattle, the likes of Ibu Cham, that have been there, that have really believed in the Innovarx journey. I've just been the one who's probably made most of the sacrifice, but so many Gambians, that put in their hard-earned money to believe in the company have been there. And just Gambian diaspora in general, I think our story is yet to be told. but just really, really proud that when we look back as well, our children would, this is on the internet, so it stays forever.
Yes.
So our kids will know that our parents also played their part as well too. So really, really honored. And, I'm always available when it comes to positive things that build and move the nation forward. Those are things I'm always excited about.
Thank you so much, Doc. I really appreciate you, man. Regards to the family.
Thank you. Likewise. And thank you for all your followers. And hopefully we'll connect soon.
Of course. Thank you. Bye.